My name is Dr. Buonassisi, and I'm a board-certified facial plastic surgeon with a practice in Vancouver, Canada. I've been specializing in cosmetic rhinoplasty for almost 20 years, and I'm here to answer your questions about this very interesting procedure. Happy patients are educated patients, and that's why every question is a good one. All right, so it's been a week since your surgery. We're taking the cast off today. This doesn't hurt.
Okay.
But it's always kind of a tense moment because I'm wondering if it looks good and you're going to wonder if it looks good. So this will be pretty easy. We'll just slip it off.
The first few days, well, right after the surgery, I was like feeling so great and I was so surprised. Like I went back and I was watering all the plants in my apartment and my mom came over and I was just feeling so great. And then the next morning I woke up and I felt like I had been hit by like a bus. And it was kind of rough. I think mostly because I had to sleep upright and then I couldn't breathe at all through my nose. So I just kept waking up every hour and my mouth was like so dry and I just felt so uncomfortable.
So I'm just gonna, you've got a little bit of sort of swollen tissue. I'm just gonna squeeze some of that out a little bit so that on your first view you don't see this big swollen nose.
Okay.
And you're gonna have a little bit of some little blood clots and stuff underneath there. And those will all go away on your first shower. And I'll give you a mirror. Actually, I'll give you two mirrors. One of them looks straight forward.
Oh my gosh, my face.
And then the other one, if you look straight forward, just keep it forward like that. And then I'll bounce your profile at you.
Oh my gosh. Oh my gosh, I love it. Thank
Yeah, it looks good.
So much.
I think it's pretty close to the images that we did.
Wow. But then as the days kind of went by, I like slowly started to kind of get a little bit more used to like my routine and just kind of like easing into having a week of being lazy and enjoying it. And then the last 2 days I actually went back to work and I work from home, so that was like really easy to do. And I was really happy that I got to sort of get back on track as the week went by. And then today, right before my cast went off, I like went out in public and I'm feeling pretty good today. So I feel like it was like a pretty steady like up curve all week. I can't believe that's my face.
It's funny, eh?
Wow.
Yeah, it'll take a little time to get used to. You can hold those two if you want.
Thank you. I'm just gonna stare at this all day.
Yeah,
That's
and I
crazy.
think not much
Wait,
really.
Oh my gosh.
You're going to be a little swollen up here still, so you'll look like.
Oh, okay.
Was it Avatar? Is that the movie?
I felt like sleeping was really uncomfortable at first, and I think even now I still have to sleep upright, so it's not really ideal. I'm usually like a side sleeper, but I think I'm gonna try and stick with sleeping on my back for now because I've heard it's like much better just for your face and your back in general, so maybe it's a good thing. And then breathing through my mouth is like not that comfortable. I feel like I don't know. I feel a bit gross breathing through my mouth all the time, or if I'm eating with friends or my boyfriend, I feel gross having to like breathe through my mouth and eat through my mouth. So I'd say it was like uncomfortable, but at the same time, whenever anyone would ask me like if it hurt or if I wasn't having a good time, I would just say like, well, I'm really, really happy it happened. So I'm not really gonna complain too much. So a bit uncomfortable, but not that bad.
There's a tiny little nick that I make in the skin on the two sides, and that's where the little chisel goes in. And that'll be a little swollen for, I don't know, a week or two, and then that goes away.
I have a little bit of a black eye, so maybe my boyfriend will be feeling uncomfortable walking with me. But no, I feel fine. It took me a couple days to feel comfortable walking around with the nose cast on, and I felt really shy about it. But after a few days, I just kind of had to get over it.
So we've just removed Ashley's cast. Her surgery was a week ago. And I'm just going to talk through with you what you can and can't do.
Okay.
First thing I think best, ideally, is just take a long shower, let water run over your nose.
Okay.
Don't scrub it. Just let the water kind of dissolve the little blood clots so you can start splashing water into your nose. And then we asked you to get a spray bottle with some salt water and you can start spraying that in your nose as well.
I guess if someone else is thinking about having a rhinoplasty, I think it's really important to like do a lot of research and who's doing it. I think if you're trusting someone with your face, you should make sure you're trusting that person a lot and make sure you're working with like a reputable clinic.
Otherwise, you can put a little makeup on the nose if you want, but don't use anything that's difficult to remove because I just don't want you scrubbing and all that kind of thing. If you have to sneeze, let it out your mouth.
Okay.
No sunglasses, so don't put anything on the bridge of your nose for 6 to 8 weeks.
Okay.
And just
get a hat.
Be careful about activities that are risky. Obviously you're not going to kickbox or something like that, but even just casual game of basketball or something like that, it's a little risky.
Okay.
So I wouldn't really, I would avoid that kind of stuff for about 6 to 8 weeks.
Okay.
So there's some little stitches, you can barely see them, but there's some little stitches here that are going to dissolve on their own.
Okay.
And I would just let them. Let those just wash off when you take a shower.
Even though there's like a little bit, I guess when I have the shower, it'll
Those
probably
will come off. Yeah.
Okay.
Yeah, you can take a little cloth and very, very gently wipe the area, and little bits will come out each day. And I would guess in a day or two those will be gone.
Okay.
There are some stitches on the inside though, and they're a little stiffer than these, and they're going to last for several months. And they're the ones that are kind of holding your tip together in a tilted position and securing your the two cartilages together, which we did to make them a little narrower.
Okay.
And those are going to last for about 4 months. Don't pull on those, but also don't be alarmed if you feel them if you poke around up there.
Okay, I think I might have accidentally disturbed one yesterday.
I'm sure it's fine. What you may notice is that when you exercise, your nose may become a little swollen, and that's very common. I would avoid really hot places like hot yoga.
Okay.
If you're going to do cardiovascular exercise, I would do it outdoors so you stay cool. The one thing that you could do is there's one area right about here that seems a little squishy to me, and it's where you had most of your hump.
Okay.
So your hump was sort of projecting forward and projecting your skin forward.
Okay.
Now that we've taken that hump back, you still have that skin. And that skin is going to have a tendency to be a little swollen or fill up with fluid. So if you can sort of squish that down onto the bridge of your nose, and you can do it with tape. Yeah. So not everybody needs to tape, but I think there's one area here that I kind of get the impression that maybe it's a little bit puffy.
Can I take a look at that?
Yeah, it's right about there.
Oh, okay.
And so what I would suggest is that you put a little bit of compression on that. You don't really see it on your profile, but it's very subtle. But rather than pushing down on it with your finger all day, you could just use a tape to do that. And often what I suggest is if people see an area that maybe has got a bit of a curve to it, that they put a tape on it at night.
Oh, okay.
So all you're doing is basically just squishing that skin down with a little tape. You can use any tape, but we use something called steri strips. So that just squishes that area down. You could put one above and one below if you wanted, but that's kind of the main part that I would think you might benefit from it.
Okay.
The idea is that you want to wear that maybe at night when you don't care what it looks like for a few weeks. When you're not wearing it, if you're not getting swollen and it looks just fine, then you're done. You don't need to wear it anymore. And not everybody needs it. I think maybe for a couple of days is all you'll need it for.
Okay.
Just to kind of compress that tissue so it doesn't stay swollen.
Okay. I don't think I told you guys this, but even before I had started working with you guys, I looked up Dr. Buonassisi because he's like rated #1 in Canada, and I had spent so long going through all the articles and the before and afters and just I feel like seeing the before and afters and like reading articles from the clinic that you're thinking about going to tells you so much about what you need to know about the surgeon that you're about to see. And another thing that I tried to do a lot is kind of temper my expectations. I think at first I was looking at pictures of like celebrities who've had nose jobs and just like, or I don't know, models with really, really tiny noses, and I kind of had this thought of thinking that if you're gonna get a nose job, you'll look like them, but then I had to sort of recalibrate my thinking and realize that I'm just gonna look like myself with a different nose, and I think that helped me a lot too.
Thanks for listening, and check back regularly for new questions and my honest answers about rhinoplasty.